due to numerous reasons under the sun, whether it be loss of nerve signal to your reproductive system through compression of S2, S3, S4, or hormone depletion levels due to chronic pain. Um, we all have issues, it seems, with our sex lives when it goes with, chronic low back pain and the pain that we suffer. And so I wanted to do a little bit of a tips and tricks kind of thing as far as things that my husband and I have at home for, you know, helping aid in sex when your back hurts or you have other issues. Um, I actually have a tumor on my pituitary gland called a prolactinoma that actually secretes prolactin, and I take medication for it to suppress that. But when your body secretes extra prolactin, which is the milk producing hormone in women, it actually causes all of your other hormones like estrogen and progesterone, testosterone to go dormant, because that's what Mother Nature intended. And so vaginal dryness is a huge concern, and along with EDS, my Ehlers-Danlos syndrome, and the fact that most of my skin is incredibly easy to tear, lubrication can be a very big issue. And so it was actually another sister on one of the boards that recommended these. They're natural vitamin E suppositories, Carlson brand. They're, you just basically, they're suppositories. They're pure vitamin E, and coconut and palm oils. And basically, you insert them into your vagina, and about 15 or 20 minutes, it will melt, and you will have what seems to be almost natural lubrication versus, the KY jelly products and that kind of stuff. I have found these very valuable. Quite a few of us actually in my little circle of sisters, my support wheel, have used these, and I highly recommend them. You can get them off Amazon. Just vitamin E suppositories. You can insert them with an applicator or just the natural way. And another couple of things I wanted to bring forward are things that will help if you have a lot of pain during sex as far as your back, because positioning can be a huge concern. It seems that in my marriage, my husband is so overly concerned about hurting me, as far as hurting my back or hurting my sacral area, that it becomes a major issue with any time we try and have sex. And so we have actually had these things for quite a while. And the first one I've actually hung from my ceiling fan, because it's really the only way that I knew to hang it up. Of course, you could not hang it from your ceiling fan unless you weighed, like, I don't know, 15 pounds, because it's actually an aerial yoga kind of sling, which basically supports your body, and you have some attachments to support your legs and be able to basically position yourself in a very comfortable position, and they are attached by carabiners. But basically, you've got this big hammock kind of sling that even my big old booty will fit in. And you have 2 carabiners, so you just need to have a good structural surface for you to attach the carabiners to that'll support your weight. And then there's a number of these tethers that you can use to position your legs to where you can get comfortable. And plus, your alternative is one of those gaudy sex swings that you can get from like sex toy stores, which are incredibly expensive. I think they're probably $200 or $300. I purchased this off of eBay for like $35 shipped, I believe. And it comes in nice pretty colors. It's like a parachute material is really what it is. But this works wonders for kind of being in a free floating kind of position, especially if you have a partner that also has a bad back, because we don't really talk about that, but you could have a partner that also has a bad back, and so this would be a good option for both of you, because this hasn't put a lot of pressure on my sis, because and I'll talk about the emotional side of things, because I have quite a ways to go on the emotional trauma of going numb below my waist, and I'll talk about that. But I wanted to show you some ideas for things that you can purchase to help ease things along, because getting your sex life back after surgery, or while you're going through the time that you've been diagnosed and you may be considering surgery, trying to maintain your sex life is incredibly important. Just overall, it helps with your depression and your anxiety and your relationships, and it's just numerous ways. And so any effort that you can make is well worth it. And so I wanted to actually show you kind of some of the things that we actually have in our home to help with that.